Bismillahirrahmanirrahim. In this video, I will speak about very important symptom in pulmonary disease, which is cough. Cough is a frequent symptom of many respiratory diseases and is often associated with underlying lung pathology and an abnormal chest X-ray. And cough can occur in otherwise healthy people and is often a self-limiting symptom. And coughing is a protective reflex. It can remove substances that have been inhaled, such as dust and excess secretions that have built up in the airways. Coughing is how the body cleans the lungs and airways. And cough may be dry or wet or productive. A dry cough does not produce any mucus, and productive cough is one that produces mucus and may cause feelings of congestion in the chest. Types of cough: acute cough, which is cough lasting below 3 weeks, usually due to viral upper respiratory tract infection, and subacute cough, which lasts for 3 to 8 weeks, and chronic cough, which is lasting more than 8 weeks. Patients with a normal chest X-ray and persistent cough are often grouped under the heading chronic cough. It can sometimes be difficult to determine the underlying cause, which indicates doing investigation for the patient. Causes of cough with or without chest X-ray abnormality. Causes of cough include respiratory causes, mediastinal causes, cardiac causes, ANT and GIT, CNS, drugs, and others. Respiratory causes of cough include infection, chronic bronchitis, obstructive airway disease such as COPD or asthma, and cough variant asthma, eosinophilic bronchitis, obstructive sleep apnea, lung cancer, bronchiectasis, and cystic fibrosis, interstitial lung disease, and airway irritants such as smoking, dusts, and fumes, and airway foreign body. Mediastinal causes of cough include external compression of the trachea by enlarged lymph nodes, such as in lymphoma and tuberculosis, mediastinal tumors, cystis, and mediastinal masses. The cardiac causes of cough include left ventricular failure and left atrial enlargement, such as severe mitral stenosis. ANT causes of cough include upper airway cough syndrome, including acute or chronic sinusitis, post-nasal drip due to perennial allergic, or vasomotor rhinitis. GIT causes of cough include gastroesophageal reflux syndrome, esophageal dysmotility, strictures, or pharyngeal pouch causing repeated aspiration, and esophagobronchial fistula. Central nervous system causes of cough include neurological disease affecting swallowing, causing repeated aspiration such as stroke, multiple sclerosis, motor neuron disease, or Parkinsonian disease. Drugs or medications such as ACE inhibitors and some inhaled preparation can cause cough, particularly ipratropium. And other causes of cough include idiopathic cause, earwax, which cause vagal nerve stimulation, and psychogenic causes. Investigations. In order to know the cause of cough, we can do the following investigation: chest x-ray, spirometry, metacolline challenge test, serial peak flow recordings twice daily for 2 weeks, induced sputum examination. Then we can do high resolution CT, and we should consider ENT examination if predominantly upper respiratory tract disease resistant to treatment, and we can consider sinus CT, and we can consider bronchoscopy if foreign body possible or history suggestive of malignancy or small carcinoid in the bronchial disease, and we do it after CT to help guide the bronchoscopist. And we consider 24-hour ambulatory esophageal pH monitoring and consider esophageal manometry for esophageal dysmotility. And we can do investigation for cardiac CNS causes such as echocardiogram or CT brain. Treatment of cough. The initial treatment of patients with a chronic cough is determined by what the most likely underlying cause is based on history and investigations. And the key is to give any drug treatment at a high enough dose and for a long enough time, such as 2 to 3 months, to be effective. Symptomatic treatment for cough. Over the counter medicines may provide relief, although there is little evidence of a specific pharmacological effect, and we will consider some possible treatments such as honey and lemon, which are home remedies, dextromethorphan, which is a non-sedating, non-opiate component of many over-the-counter cough remedies, menthol, which is short-lived cough suppressant, sedative antihistamines, suppress cough but can cause drowsiness. It is good for nocturnal cough. Codeine and codeine and volcodeine, which are opiate antitussives. Codeine requires prescription, no greater efficacy than dextromethorphan, and greater side effect profile. Opiates prescription, low dose morphine sulfate 5 to 10 mg showed significant improvement in patients with intractable cough in a randomized controlled trial. Side effect profile of opiates, so should be used with caution. Gabapentin prescription, neuromuscular neuromodulator used for chronic pain, not yet licensed for cough, but randomized controlled studies treatment success in some areas in United Kingdom. Thalidomide used in cough due to interstitial pulmonary fibrosis with randomized controlled studies showing significant improvement in cough quality of life. Assessment of the treatment response. Several measures have been developed and validated, such as cough visual analog scale and cough questionnaire and the cough reflex sensitivity measurements, which primarily a research tool. Now I will enumerate some causes of chronic cough. As we mentioned before, that chronic cough is a cough lasting more than 8 weeks, and the causes include bronchial asthma, gastroesophageal reflux disease, chronic obstructive pulmonary disease, and ENT causes including chronic rhinitis, chronic sinusitis, what's called post-nasal drip, other causes include medications such as ACE inhibitor, and lastly, it may be idiopathic. I hope this small video be a beneficial, and thank you.